Today we are diving into the world of pregnancy. We are going to cover the range of experiences that couples have with sex during pregnancy, sexual desire, talking about some of the physical and psychological factors that play a role in whether or not you might have increased desire, decreased desire, or maybe it's staying the same.
Welcome to the Pleasure Program. My name is Holly.
I'm Victoria.
We are two licensed therapists specializing in sex therapy, here to answer your questions and share our knowledge around all things related to a healthy and pleasurable sex life.
So, expecting a baby can be a really exciting, overwhelming, or sometimes even dreadful time for couples. People have different reactions to their pregnancy due to their individual circumstance, and that's completely normal. But one thing that's really common is couples are worried about how their sex or their intimacy might change throughout pregnancy. Today, we are going to dive into how your sex life might change throughout a pregnancy, why, and what to do about it.
For many couples, their sex lives might not change at all, or there's very minimal change. So some couples, they continue to have sex as they would normally from conception all the way to childbirth. Some couples even experience an increase in desire during the second trimester, mostly due to the pregnant partner having some additional blood flow to the genital area and everything just feels a little bit more intense. Orgasms can be a little bit more intense, and so they even experience some benefits in their sex life due to pregnancy.
Yeah, that's one end of the spectrum where some couples have even improved sexual desire. And then on the other end of the spectrum, we have some rare cases, seems to be like less than 1%, where sexual intercourse is dangerous and it is completely taken off the table. Again, that's rare, but these are two of the broader ends of the spectrum of pregnancy. So let's talk about what happens on average for sexual functioning.
Research indicates that in heterosexual relationships, men, generally speaking, tend to have higher levels of desire than their female partner throughout the entirety of the pregnancy. For men, desire will gradually decrease throughout the pregnancy, with it being at the lowest at the end of pregnancy. And for the female partner that is pregnant, desire typically decreases the most during the first trimester, and it increases during the second and third trimester. Interestingly, for female partners, desire peaks most during the second trimester, sometimes even more than before pregnancy.
It sounds like we're seeing a trend here. Male sexual desire diminishes, female seems to diminish at first, then kind of recover, sometimes even more so, but let's talk about why sexual desire might seem to diminish in pregnancy. So let's start with some of the psychological factors that impact desire. Firstly, one of the issues is that sometimes pregnancy is viewed or experienced as a loss of identity, a loss of freedom. The pregnant person feels like their body is no longer their own, so it's really hard to feel desire and sexy if it's not even really your body. And then some women also struggle with feeling a sense of security. They may not feel secure in their relationship or in their housing or finances. And if these things are unstable in your life, that could definitely impact feelings of safety and vulnerability to have that sexual desire.
Women who are pregnant often feel that there's expectations around motherhood and what that might look like for them, what qualities they may exhibit or lack that seem to support their expectations around motherhood. And depending on what you have for support in your life, the people around you, you can feel kind of alone and isolated and I think quite a bit vulnerable during that time. And all of those factors are going to play a role in diminished desire.
For psychological factors in the different trimesters, like the first trimester, the pregnant person is generally their mind is preoccupied with the changes that they're going through, right? And so if your life is tumultuous feeling or there's turmoil because there's changes happening or there's a lot of unknown, that can take out some desire. In the second trimester, usually fears start to develop around the baby, especially once mothers are able to feel fetal movement. That feeling the baby after they have sex or during having sex is unsettling for them, and they fear that the baby is maybe uncomfortable or hurt or overall just feel a lack of privacy. And lastly, in the third trimester, fears and anxieties around birth increase, so they're preoccupied with that. And then there's also sometimes an increased dissatisfaction with their body image, right? Things have changed, there's swelling, there's abdomen growth, and so these changes and discomforts may create a barrier to that desire.
We've talked about in past videos how intrusive thoughts, like distracting thoughts, can get in the way of really being present and in the moment and embodied in a way where you're really in touch with your own pleasure. So all of those distractions and intrusive thoughts and worries would make sense that they would get in the way.
Absolutely. And there's so much to think about with creating life.
It's something to be mindful of because your partner is experiencing these changes in her body 24/7, even during sleep. And it's an experience that's always at the forefront of her mind.
There's also psychological factors that impact desire for the pregnant person's partner, male, female. There are things going on for them as well that could create less frequent sex throughout pregnancy. Firstly, there might be some insecurities around abilities, right? Whether it's abilities to be a supportive partner or a parent or be in the right career and have financial stability, or insecurity around housing. Similar things to what we just talked about for the pregnant person going through.
And during sexual encounters, you can feel the baby move or notice the movements happening, and that can be, again, contribute to a feeling of lack of privacy, like there's another person there, and it can be distracting and create intrusive thoughts for your partner who's not pregnant as well.
Yeah. And it's really normal to have some ambivalent feelings around pregnancy. There's a lot of really maybe exciting things happening or a lot of really scary things happening. And so, having those ambivalent feelings might feel uncomfortable, or you might feel shame around them or struggle to talk about it and not know that it's normal. And so that could create a barrier as well.
For partners, there can be fears around a loss of control, right? There's something happening, really amazing happening, but also kind of scary and a bit mysterious, right? Happening to your partner and your partner's body, and not knowing how that's going to turn out or what might happen throughout the pregnancy, how childbirth is going to go for your partner and for you. So that increase in not feeling like you have control over the situation can impact your desire for sure. Also, I think that for the pregnant person, they're getting so much attention and medical attention and support from friends and family and coworkers and all of that for their partners, they can feel a little bit excluded and not part of that experience in the same way. And that can also get in the way of feeling desire, maybe even trigger feelings of jealousy.
And it's normal, right? No reason to feel shame around that.
Mm-hmm.
As you can see, there's lots and lots of potential psychological factors. We don't even cover them all. There's not enough time to cover them all, but that's just a basic kind of run through of some. So you can see how many different psychological factors can impact your sex during pregnancy to help normalize changes in that, right? If you're not experiencing those factors, great, that probably means that maybe your sex isn't as impacted. But if you are, totally normal that it is impacted. Plus, along with psychological factors, there are so many physical factors that impact desire throughout pregnancy. And they typically peak in the first and the third trimester.
One of the most obvious physical factors would be hormone changes, right? Feelings of increased nausea during the first trimester, aches and pains in the third trimester, just from carrying that additional weight associated with the baby and the placenta and all of that, all the extra blood that's created there. Painful breasts, breast tenderness, an increased sense of smell, things smelling really strong, like your partner's breath or their feet or food or the trash that's 2 rooms away and you can still smell. That's gonna get in the way of being present and
There's
feeling
so,
sexy.
Yeah, there's so many women that if you even like just browse online for women and what they're struggling with throughout pregnancy, that hate the smell of their partner.
Oh, just in
Which is
general.
so sad, just in general. Like,
Terrible.
it's just something. Some people are just like, I'm just like aversive to humans, right? Like, what are you gonna do about that? Like, that's awful. Of course, that's gonna create an issue with desire, right? And if you're having like heartburn or headaches or constipation, like, who finds those things sexy? Not a lot of people, right?
Right. Exactly.
And you're getting an enlarged uterus, and this can create pains, stretching pains, ligament pains.
And towards the end of pregnancy, you get quite swollen, a lot of fluid retention. Your feet can be really sore, back can be really sore. It's hard to feel sexy and in the mood when you're struggling with your body physically. It's going through a lot. It's doing a lot.
For sure. And we've talked a little bit about female orgasms in a previous video, and that actually changes with pregnancy. Typically, you have a normal, like, rhythmic contraction during an orgasm, but that can change to a prolonged, sustained muscle contraction, especially in the third trimester, which can actually be painful. So some women experience painful orgasms during pregnancy, which takes a lot of fun out of it.
Yeah, for sure.
Also, what's really interesting is that there are actually physical factors for the partner of a pregnant person. So they can get psychosomatic symptoms, which reflect fatigue, exhaustion, nausea, and it's been associated with issues actually around acceptance of the pregnancy, as well as a drop in cortisol and testosterone levels. So partners' estrogen and prolactin levels also can increase, and these hormone fluctuations can impact their desire. So it's not just the pregnant person going through physical changes, it's actually their partner as well that can impact this.
Wow, that's fascinating. So just the mind-body connection is really interesting. And so what we can manifest as symptoms in our body subconsciously, right? It's not like it's on purpose, but your partner, the partners of the pregnant individuals can also have some almost like sympathy pains would be like the layman's term, maybe.
For sure.
So some of these symptoms go away in the second trimester, which can contribute to an increase in sexual desire in your relationship. We already mentioned an increase in blood flow to the genitals that can create an improved sensation that's pleasurable and stronger orgasms. Some women experience more frequent orgasms as well during the second trimester. And we're normalizing the variability and fluctuation in sexual desire during a relationship, during a pregnancy. But if you're listening and you're like thinking to yourself, well, sex didn't get better in my relationship during the second trimester, that's also normal. There's such a wide range of experience when it comes to pregnancy, both emotionally and physically. And even for the same individual, one pregnancy to the next pregnancy. So it's all normal and to be expected that there's going to be some variations. But if for any reason something feels off, something seems wrong, you're not sure, call your doctor. Ask those questions. Make sure you're getting checked out. You deserve
Peace of mind.
Yes, you deserve peace of mind.
Yeah. Clearly, there's lots of nuances to pregnancy. There's a lot of reasons that make it normal to have diminished desire, increased desire, have a complete desire discrepancy between you and your partner, right? We mentioned earlier that typically, like for heterosexual couples, males have increased desire over females for the entirety of the pregnancy. So struggling with that discrepancy can be really difficult.
We have a couple of previous videos that address how to approach and handle desire discrepancies in a relationship between two partners that we'll link below and are really good resources to check out for more information on how to address it all.
But we'll summarize a few tips here. When these discrepancies happen, the person with the lower desire can typically feel anxious or guilty, worried that this is bad. And then the person who has the higher desire can often feel neglected and rejected. And this can create a tough dynamic between the two.
If you have any worries about harming the baby during sexual encounters with your partner, seek advice from your medical professional involved in the pregnancy. I think that will help ease any concerns or anxiety you have. Generally speaking, sex is safe and just fine to engage in during a pregnancy. However, there are some rare cases where you might need to refrain from any intercourse during the pregnancy. So seek some consultation with your medical provider.
Definitely. Even if you want to talk to them about the symptoms that you're experiencing that are getting in the way of your desire, whether it's nausea or headaches or pain, they might be able to help you navigate that to help with getting some of your desire back, right? And it might be also simple things as like changing positioning of sex. Sometimes with pregnancy, there are some positions that just don't work for your body at that time, and they might be able to give you like helpful tips of what might work differently depending on what's going on with you. And it's especially important to just communicate with each other, right? Like we talked a little bit about shame and having these feelings and maybe not really talking about it, but a lot of feelings are really normal in pregnancy, and so you should talk about them. Talk about them with your partner, talk about them with your doctor or your friends. Get that support so you're not withdrawing with your shame and creating this kind of distance between you and your partner.
Yeah, I think saying something like, I'm noticing it's been really difficult for me to feel in the mood, and that's not normal for us. And I'm feeling worried about that, or I'm feeling guilty about that. Like, how are you feeling? And I think something else to be mindful of is that this all fluctuates and can change from 1 week to the next during a pregnancy. And I think we can catastrophize sometimes when we go, oh no, like we're not having sex as much as we normally do, or I'm not in the mood and normally I have a higher sex drive than I am right now, whether it be the pregnant partner or their partner. And we can think the worst, and trying to just be gentle with yourself and flexible that this is something very new and different happening within the relationship and within your partner and your partner's body. Try to just ride the wave and be okay with some fluctuations happening.
Absolutely. And something else, research has pointed out that sexual desire, ability to become aroused and achieve orgasm in pregnancy, these things are related to quality and satisfaction of the partnership. So just like take a quick peek at what your partnership looks like outside of pregnancy, right? Are you guys connected in other ways? Are you guys still prioritizing yourselves as a couple, right? Like, are there ways to build more connection, more communication, more closeness, right? Are you guys arguing all the time about things? Like, should you maybe see a couples counselor? Like, really take a peek at what's going on to see if you can increase the quality of your relationship outside sex, and that could have a huge impact on your sexual relationship.
That's a great point. Yeah, you want to stay strong as a partnership and make sure you're staying healthy in all areas. And if there's work to be done, what a better time than to do it before baby arrives, because that shakes things up even more. So if you're feeling like, gee, there's some areas in our relationship that could use some attention and maybe some help or support around, couples therapy is a great option to consider.
Yeah, absolutely. And if you have painful sex or you've had to take sex completely off the table, it's especially important to think about how you can connect, right? Like, what other ways can you connect? Can you connect via physical touch in massage, or is oral sex pleasurable, or do you guys need more dedicated like date nights where you have close, intimate conversation? Like, what do you need? Mutual masturbation? There's a lot of different options here.
Get creative. Understand that lowered sexual desire is a normal experience and phase of life. It's normal to experience a decrease in your frequency of sex during pregnancy and perhaps other seasons of life. Remember, it's temporary, and lean into the other joyful areas of your relationship together.
We want to know, how has pregnancy impacted your sex life?
Leave us a comment below. Share your experience with us. Let us know if you have any questions about this topic. Feel free to like and subscribe if you enjoyed this video, and we will see you in the next one.